Okay, good afternoon to everyone. We are now on the last two weeks of our pathophysiology, and we are about to consider the topics for the pathophysiology on the pathophysiology framework. And our topic for this week is related to the risk factors. Risk factors are very important to consider for a nurse to be aware when it comes to the possible development of complications, or it may also have implications when it comes to the severity and prevention of the individual's health condition. The risk factors are also very important to give us a clear overview of the pathway when it comes to the extent of what are the specific diagnostic examinations that will be subject for the client to have. Now, I know that you are being prepared for the second and the third cycle for your case presentation. However, pathophysiology is very important to consider, simply because this could be a way on how it will direct each uh, risk factor on the development of complications. Now, when it comes to this perspective, our responsibility as nurses to know of knowing the risk factors are being gathered to be part of the data that will be useful for the nursing care plan. In the nursing care plan, one of the important data that you may have are the specific data on assessment, and thus this will be the basis for us to consider in the formulation of nursing diagnosis until the intervention. Now, when we talk about risk factors, from the term itself, risk and factors. So the risk is a term that is being used whenever the person is possibly that can attribute to a specific disease or health condition, and factors are considered possibly as characteristics or situations that may be significant to contribute in the development of disease or a health condition. Now, when we combine risk factors, then uh, it is considered as attribute, characteristics, or exposure. Okay. So later on, we will try to differentiate what are precipitating factors, what are predisposing factors, what are perpetuating factors. We will distinguish definitely the differences of these factors. What are non-modifiable risk factors and what are modifiable risk factors? Now, according to the World Health Organization in 2017, risk factors are attributes, characteristics, or exposure. If we say attributable, yan. Attributable meaning this may contribute, this may lead, this may direct a situation on a specific health condition, a disease process, or somehow may lead to complications. When we talk about characteristics, the characteristics are basically defined if, for example, there are some situations upon patient history which may consider as genetically acquired, inherited, or it could be familial. So those are genetic characteristics which we may identify if the client is high risk for a specific health condition, disease condition, or possible complication. When it comes to exposure, the exposure could be environmental. And since we have already finished the discussion on the chain of infection, we have identified the concepts of infectious agent, reservoir, portal of exit, mode of transmission. We have the portal of entry and susceptible hosts. So this chain, this concept of chain of infection may also consider exposure because just like in the chain of infection, exposure could be exposure to the body secretions of reservoir. So that is portal of exit from the reservoir. How about exposure of the individuals when it comes to direct physical contact? So that could be mode of transmission. And if we have considered, for example, that the person had an exposure when it comes to the infectious agents or to the infected secretions through an open wound, through inhalation of the through via respiratory tract, so that's already portal of entry. So those exposure could be attributable depending on the situation. But however, with the concept of the chain of infection, we can associate it depending on the situation wherein it is applicable. That's why it mentioned here that the attributes, characteristics, or exposure can increase the likelihood of developing a disease or an injury as well. So let us now identify what are non-modifiable, what are modifiable, lifestyle, and the social factors that we may consider. The non-modifiable risk factors are identified accordingly. We have the age, the gender, family history, just an example, family history of cardiovascular disease, ethnicity, genetic evidence, and previous history of cardiovascular disease. Now, when we consider non-modifiable from the term itself, modify, change. But if it is non-modifiable, these are risk factors that cannot be changed. However, the basis of having data, if the person could be leading to a risk factor which is non-modifiable, it will be based from the recent literatures and findings. For example, lifestyle can be can have an associate can be associated or can be related to non-modifiable risk factors. For example, at the moment, the cause of the cardiovascular disease is, for example, smoking, and yet smoking is considered as a lifestyle. And now, if we will try to check the literature of the age group, population, age range on the engagement of individuals to smoking, before, male individuals have the highest percentage or data that can be associated to smoking. But as of 2020 and 2021, almost the data revealed that almost male and female have the same number of data and percentages of the engagement in smoking. In the previous literatures, male had been identified as one engaged most in smoking. And when it comes to the age, most, as the time as the record shows, that the age that had been identified based from literature is 18 to 25. So somehow this could be related as part of the risk factors. So it can associate other risk factors such as lifestyle and non-modifiable. However, we cannot change the age. If it is identified that the age is, for example, increasing age cannot be changed actually, since we have been oriented in the growth and development of the physiologic process and functions, we expect that there will be changes in the increasing age. Just like, for example, as what we have mentioned way back on the discussion of the COVID-19, most of the infections had been identified highly vulnerable population are the elders, simply because of the delay physiologic response and low immune response of the elders compared to children. Age also may take into consideration hormonal level. So hormones are active most in the early adults compared to elders, because most of the elders by age group are classified as andropause and menopause. So most probably hormones are not active when it comes to the cellular metabolic activity. Unlike for those who are in the early adulthood, individuals are starting to increase their reproductive hormones, which are on the part of puberty. So since the hormones are active, cells also respond actively when it comes to the needs to have the equilibrium and homeostasis. So that's why the age and the gender are considered as non-modifiable, this because this has been constant. However, this could be data could be changed according to every diseases, but if it is based from evidence-based data, then this could be the basis, our basis as nurses, if individuals could be high risk. Just like for example in the situation like COVID-19. So we have mentioned na when it comes to vulnerability, high risk po ang elders and the age accordingly. And based from the age, most po that are affected, or rather gender that are affected from the elders are male. So for Filipino profile, demographic profile. So on that note, we can use those literatures to basically explain our framework. If for example, we have a client who is 75 years old, male, so the 75 years old, we can associate the non-modifiable risk factors through the reference of physiologic response and immune response. By gender, this may also associate with physiologic response because of the specific reference of what are the expected changes that happens between male and female. And for males, we could consider po yung direction or data that will be a reference for the present condition of the client that you are attending with. Now, when it comes to the family history, for the family history, we will talk about in the etiology, on the concept of etiology, about familial and genetic disorders. Genetic disorders are identified and defined that this could be coming from the parents or from the previous generations. So that's why most of the cardiovascular diseases are identified as familial. So other than that, ethnicity. When it comes to the ethnicity, that's why if you will have your research, the ethnicity matters because of the body's response to the particular disease or illness. Just like for example, if you will notice, when it comes to the ethnicity, our ITAs or tribes rather, our tribes from the mountains have different lifestyle compared to the individuals who are in the urban area. So they still have when it comes to the ethnicity, they still have some traditions that may possibly contribute to their situation of developing illnesses. There are some practices also that may be associated with ethnicity, just like for pregnant, for delivery, for labor and delivery. Those individuals who are living in the mountains with the tribes have different practices. The way we witness individuals who are being hospitalized or admitted in the hospital. Unlike those considerations in those areas, they have not adopted the practice in the urban areas. However, why is it when it comes to development of complications, they have different percentage on maternal and fatality as well. So these are you need to be more you need to be more research oriented when it comes to knowing the risk factors. When you make your diagram in pathophysiology, you will not, for example, these are the risk factors that have been identified. You will not indicate all of these risk factors unless if it is a case-based po ito, or rather case-based yung data that you will consider, then possibly factors that you will consider in the pathophysiology are based from the information provided only. So if you will take risk to include risk factors but it is not based from the information gathered from the patient, it may cause inconsistencies, and it may lead to difficulties on how you will explain the direction of why the patient have identified risk factors such as non-modifiable, modifiable, and the lifestyle or social factors. So it's the same as genetic evidence and previous history of cardiovascular disease. Kasi yung non-modifiable, why we consider previous history of cardiovascular disease? Kasi yung tinatawag nating recurrence. Once a person may have familial cardiovascular disease, then I diagnosed with cardiovascular disease, these are considered as modifiable risk factors because eventually the person had already tissue death on the part of the heart. So just the same as for tuberculosis. Di ba pag tuberculosis, yung previous history of tuberculosis, it can still be identified if you had history when you had your chest x-ray, because tuberculosis can lead to tissue death in the lungs, and it will still have a mark whenever you will be subject for chest x-ray. So these are the non-modifiable risk factors: the age, the gender, the family history, the ethnicity, the genetic evidence, previous history of cardiovascular disease. Let us now proceed with modifiable risk factors. When it comes to the modifiable risk factors, obviously the term itself is it can be changed. It may depend on the individual's control and management on how it lead to the certain risk factors. Usually for modifiable risk factors, these are attributable to situation of what triggered those changes, and we must identify it. For example, if the patient had hypertension, you must know specifically the effect of hypertension to the body and what are the causes of hypertension, because the blood pressure may vary. It's not constant. Unlike for the age cannot be changed. It will increase. You will not, if for example, most of the literature may say that 50 years old male are high risk already for cardiovascular disease. You can go back to your early years just to not to be considered as part of the risk factors. However, when it comes to the modifiable, just such as the blood pressure may vary depending on the individual's physiologic response, engagement into physical activities. It could contribute also nutritional management. That's why it's considered as modifiable risk factors. Another is, for example, if the client was diagnosed with a cardiovascular disease, then the client's blood pressure is normal, then you must not put it in the modifiable risk factors. One thing that you may need to focus now is if the patient has history of hypertension. If the patient has history of hypertension, then that could be non-modifiable risk factors. If the patient's blood pressure at present that you assisted the patient and not having hypertension, so you will not put modifiable risk factors if it is normal. However, when it comes to the total cholesterol, these are most of the modifiable risk factors may depend may depend specifically on diagnostic examinations. That's why, for example, level of cholesterol, level of serum cholesterol or blood cholesterol may vary. And if ever there are findings of elevation of total cholesterol, actually the total cholesterol is different from HDL. HDL is high density lipoprotein, and the total cholesterol may consider po dito yung low density lipoprotein or LDL. LDL has been identified as the bad cholesterol. So why it has been identified as the bad cholesterol? Because we all know that the cholesterol is insoluble in the plasma. So how it will will travel to the plasma by taking into consideration po that each cholesterol are encapsulated by the lipoprotein. And since it's low dense, if the lipoprotein is low dense, the greater chances po that these are the type of lipoproteins with the cholesterol that may dislodge or stays in the blood vessel. Unlike for the high density lipoprotein, the HDL can freely move towards the plasma on the circulation, while the LDL is the one that may possibly stack up and make and produce a fatty plaque, or yung what we call tinatawag nating thrombus formation once it will be dislodged in the blood vessel. So, very important, just like for example, yung level of cholesterol. Another, smoking is considered as modifiable risk factors. Sir, modifiable siya and at the same time lifestyle. Okay, lifestyle factor siya. Because smoking may depend if for example, the patient is having the smoking but not habitual. The patient is engaged into smoking but with a certain number of sticks per day compared to individuals who may have 1 pack of cigarettes per day. So they are highly vulnerable with the development of respiratory disease. Another is modifiable risk factors may consider also specifically on the blood sugar who is high risk for diabetes. Now, when we talk about the blood sugar, this may vary. That's why random blood sugar and fasting blood sugar is different from each other. The usual reference or the definite reference of the person who could be high risk for uh, diabetes are those who had been identified with the fasting blood sugar, elevation blood sugar. Unlike for the random blood sugar, usually for the RBS, random blood sugar are taken regardless of if the patient have eaten or on fasting. This is usually a consideration po ang random blood sugar whenever the client who will be subject for insulin administration or injection. Pero seemingly either random blood sugar or either fasting blood sugar, as long it's elevated, as long as ano naman yung masyado namang mababa yung level of the blood sugar, then this could be also harmful on the situation of the client. So another is markers for chronic inflammation. Okay. Ano ba yung mga markers of inflammation that we have studied in the diagnostic process, specifically in the specifically in the WBC. WBC in the complete blood count specifically can identify either inflammation or infection. So if it's on the inflammation, that's one marker. But to specifically identify through the differential count, it's through the use of if there's an existence of the basophils, the neutrophils. So these are markers also that can lead us on the possibility that the patient is having a modifiable risk factors, or in the event that you will have results of elevated WBC and components of differential count. So class, ano po yung mga modifiable risk factors? Expect po findings of results of vital signs can be modifiable risk factors. Second, results of diagnostic examinations are considered as modifiable risk factors. So since vital signs, we have indicated here blood pressure. since we have considered diagnostic examination, level of cholesterol, we have blood sugar, we have the markers of chronic inflammation. We have also taken into consideration po modifiable risk factors ang weight. Hindi siya non-modifiable kasi ang weight can vary depending on the patient's or individual's metabolic response. Kaya ang body mass index po, ang weight po can be considered as modifiable risk factors kasi we can identify if the patient is undernourished, if the patient is on the obese 1, obese 2, and we all know that obesity has contributing factor when it comes to the development of a disease. Okay. When it comes to the okay. Kasi there are some situations po. Yan tama. I received one question from the chat box. Hindi po ba familial ang weight ng tao? Actually, ang weight po it will not be familial in a way that usually kasi pag sinabi natin na okay, tabain yung pamilya nyo, then and eventually you're prone as tabain din. It may depend specifically kasi it could be considered as modifiable kasi it can be managed. Kasi kung for example, within your family, merong most are obese, pero it is considered as modifiable risk factors because it can be managed, it can be controlled. It may not be considered also as familial simply because ang obesity kasi it's only a factor that may specifically consider po perspective na yung male and female from the parents, if they are obese, it's not expected that the newborn will be high risk for obesity. Kung ang contributing factor is if the parent has diabetes, then chances the contributing ang diabetes sa pag-gain ng weight ng newborn. So hindi directly on the weight. So usually yung weight po may still be associated with a particular specific disease na familial pero nako-contribute on the weight gain. Okay? How about lifestyle po? Modifiable din po ba? Okay. Actually, that's why I have mentioned po na ang lifestyle po ay can be considered as modifiable in a way because it is within the control of the individual. However, if you will notice from the lifestyle, ang isa sa mga specific dyan that we have considered for modifiable ay smoking. So smoking is a lifestyle that can be associated. Kaya ang most na may relationship usually is modifiable and the lifestyle factors. Kasi kung for example, diet naman. O diet sa lifestyle, lifestyle is most of the time the person is engaged in eating processed foods. So anong problem with the processed foods? Fat content, salt, sodium or salt content. So by the dietary lifestyle, it can be also considered as modifiable risk factors. Exercise, from the physical activities, less engagement of the individuals to exercise can be also as modifiable risk factors. Kasi ang modifiable risk factors po, this could be managed and can be controlled. Unlike nga for non-modifiable risk factors, we cannot control it. We cannot change it. It's definitely constant. So even with the stress, why it's part of the lifestyle, and at the same time we can consider it as modifiable simply because it can be controlled because we have corresponding therapy or corresponding coping mechanisms that we may consider. So tsaka katulad sa age, very common for the age group that the person experiences or high risk for a specific disease or health condition. Unlike for the modifiable risk factors of blood pressure, it will still go back to what is the normal reference of the blood pressure for age. Kaya that's why constant Yung for age natin, we have normal reference for blood pressure and we all know that the blood pressure has normal reference for each age group. So that's why in our mindset, ang blood pressure po ay always 120/80, and yet 'di ba I have introduced to all of you na sa JNC 7 or Joint National Commission 7 na ang 120/80 is already pre-hypertension. It must be below 120 and below 80 ang tinatawag po nating normal blood pressure. That is for adult. But how about for infant? How about for children? How about for elders? So you must also take into consideration po na why we consider normal reference for this age group. Kaya that's why if ever there are findings as well na beyond normal or deviation, then papasok na ito sa modifiable risk factors of blood pressure. So, how about the social factors? Social factors could be considered po kung for example a general status of the family or individual's income. The income matters eh. Pwedeng ma-associate din 'yan sa stress. Income can be also associate also to the meeting physiologic needs or prioritization. Another is social deprivation. Some term itself as social factors. There are some situations, di ba? It may compromise yung social deprivation, just like what we have experienced during the pandemic. Yung you are not allowed to mingle with each other, not social, physical distancing. Tapos you only engage yourselves na lang into the online platform. So meron ding social deprivation diyan. And for sure, the social deprivation or social factors may contribute to the problem when it comes to level of anxiety or attributable to mental health. Another is social factors din po yung tinatawag nating environment. So environment specifically, you could be vulnerable if for example your residential area are near factories of plastics, because there are some harmful substances that can be inhaled by the individuals who could be high risk for cancer. Another is if your residential are highly populated, so spread of infection and disease could be vulnerable. You could be vulnerable also from the environment that waste disposal management are not practiced. Another environment po, for example, if you have been exposed to urban areas that are highly polluted ang air. So those are considered as social, that's specifically on environmental. So hoping when you do pathophysiology, you can specifically identify non-modifiable, modifiable, lifestyle, and social factors. Later on, we will describe also non-modifiable, modifiable, and other factors on the perspective naman ng mental health, on the perspective of medical health condition. So that's why let's proceed on the details about the non-modifiable, or rather, let's start with modifiable risk factors. So, the modifiable risk factors are things we can change, wherein the behaviors, exposure that can raise or lower person's risk. This is what I've told you, na it's within the control of the individual that pertains to modifiable risk factors. So, tulad nitong sir, bakit modifiable risk factors ang abdominal obesity? So yung tinatawag nating abdominal obesity, kasi meron tayong tinatawag na visceral at saka adipose tissues. Ang visceral tissues po ay those tissues that covers internal organ. So outside the visceral tissues, we have adipose tissues. Kaya sometimes there are situations like when you're eating food that is high in cholesterol, at the cholesterol at you are obese already, usually ang synthesized at metabolic synthesis po ng cholesterol ay slow. So since mabagal po ang pag synthesize ng cholesterol, yung fats po na supposedly ma-convert into fatty acids or because of the slow metabolic response, it already shift to the adipose tissues. Kaya pagdating sa adipose tissues, ayan, nagko-cause na yan ng additional tissues na pwedeng mag-enlarge ang abdominal ang abdomen ng isang individual. And this matters because it may add to the weight, somehow may lead to obesity. And we are aware that for the obesity, these are individuals who could be high risk of decreased metabolic response, at usually they could be high risk of situations of problem with cholesterol. So we have also high blood pressure or hypertension, even with pregnant women, di ba? For pregnant women, we have the so-called gestational hypertension. So modifiable risk factors yung high blood pressure, but we must take into consideration that we must ask the pregnant patient or client on the history of hypertension. If not known hypertension, so usually this is gestational hypertension. Hypertension usually happens only during pregnancy. So this may lead to a possible preeclampsia if, for example, there will be findings of proteinuria. So it will give us a direction on simple findings in the vital signs. It will give us significant date. It will give us a significant direction of a pregnant women. It will affect by the fetus, the well-being of the fetus. It will affect by the maternal well-being. Yes, definitely. Kung if we have high blood pressure, kasi when we define the high blood pressure, di ba usually this increase in the arterial pressure of the blood vessels, arterial pressure rather, pressure of arterial blood vessels. So eventually, arteries are identified when it comes to the systemic circulation. So if there will be pressure within the arteries, specifically with the coronary artery of the heart, this will deprive specifically the coronary circulation. So on the perspective that a patient or a client is not known hypertensive but experience hypertension, then that's the time that we can still consider it as modifiable risk factors, because any evidences that may consider with a deviation in vital signs are always considered po sa modifiable risk factors. Not just only high blood pressure, it could be pulse rate, it could be cardiac rate, it could be uh, oxygen saturation is considered as the fifth vital sign. These are modifiable risk factors. So when it comes to diabetes, actually, it's more on not diabetes it's more on the blood sugar level. But we considered modifiable kasi pwedeng ang diabetes siya mag-contributing or predisposing factors na siya because it's considered as a chronic di ba? It's a chronic illness, as what we have mentioned dun sa parameters natin in the diagnostic exams, importance of parameters diagnostic exam, one of which that identified po ang diabetes with chronic illness ay for monitoring. So eventually we can associate for diabetes as modifiable risk factors of considering yung blood sugar level. So high cholesterol, psychosocial factors could be kasi if the person himself is introvert, extrovert, so meron bang effect ito, for example, when it comes to the psychosocial. So kung for example, persons have previous experiences na pwedeng nakaka-affect siya and contributing siya sa stress, so psychosocial factors could be considered as part of the modifiable kasi it can be controlled kasi we are oriented with various coping mechanisms. So another, we have identified modifiable risk factors po ang smoking. So these are the typical modifiable risk factors, and this could be used as your checklist whenever you ask patients, and these are usual part of the checklist when you are retrieving data for patient's history. Next, other than modifiable risk factors, we have identified as well the blood lipids. Abnormal blood lipids, this is the same as on the cholesterol. Pre-eclampsia could be modifiable risk factors simply because of it may affect the fetal well-being. And chances po we can use only pre-eclampsia if there is gestational, if there is already hypertension during pregnancy and proteinuria. If no proteinuria at all, that's only gestational hypertension. Chronic kidney disease is considered also as modifiable risk factors, yung tinatawag nating kidney failure. So just the same as diabetes and the chronic and the kidney failure, usually pag mga chronic illnesses, these are considered as modifiable risk factors. Lifetime na siya, pero still it can be controlled by pharmacological management. It can be controlled by Ang chronic, di ba, ang kidney failure can be controlled by the dialysis. Ang diabetes naman can be controlled kung high level of blood sugar level is via insulin if it is insulin dependent. So next po, we are considering po the non-modifiable risk factors. So anything that is considered po for ethnicity, the age, the gender, and family history. So ang difference lang with the definition po natin with modifiable risk factors is these are the health risks that cannot be changed. And we have already given an examples or most examples pertaining to it. One of the reference that I mentioned here is yung try to take into consideration, have the have the matrix or the matrices of the normal vital signs for each age group. Kasi this will be very helpful for you to identify the specific age. Kasi may mga situations kasi na kung for example, normal reference yun, tapos lumabas ngayon yung situation, oops, the patient is hypertensive. So by his age, part na siya ng non-modifiable risk factors. Tapos po, may findings pa ng hypertension, ma-identify na natin. Kasi di ba, anything that has been identified with deviation of vital signs, papasok na yun sa modifiable risk factors. So sa family history, magkakasama yan, yung age, family history. Sa family history, usually we ask pa nga sometimes we have yung tinatawag nating genome diagram. Yung genome diagram sometimes this could be a guide that will give us information specifically on paternal or maternal side yung problem with familial history of hypertension or diabetes or any genetic diseases. So next po, so we have identified tulad nito, for the non-modifiable risk factors, we have identified nga by age. So as it increases the age, ang nagbabago po kasi when increasing the age, when pertains to heart, as it increases the age, yung valves ng heart thickens. So it means that whenever there are situations that it will continue to increase the age and it will continue to thicken the valves, it may matter. That's why in the increasing age, you are already high risk of hypertension. Moreover, kung modifiable pa, that you have familial history of the hypertension within the family. So another dito, i-relate natin naman yung sa sex. Okay? Sex or usually gender na ito, no? Gender na to in general. So before the age of 60, men are greater risk of developing than premenopausal women. Kasi ang postmenopausal women have similar cardiovascular disease risk to men. So dito po, it is based from the evidence-based findings na ang men po ay by physiologic process ay nag-start na mag-thicken ng valves compared to female. So that's why it's based from the scientific explanation na males are high risk rather than female. So doon tayo sa scientific basis and reference. Kaya every time that you will be asked, why you consider the age as non-modifiable risk factors. So your response is according to the evidence-based and scientific explanation that before the age of 60, the males or men are having valves that are thickened primarily compared to females who could be postmenopausal. So those. So how for the familial history, the risk that may be greater po if close blood relatives, lalo na family. And usually naman po sa ethnicity. Sa ethnicity naman po, individuals with African or Asian ancestry. Ayan. Kaya based from the based from the scientific explanation na Asian and African po ancestry and indigenous population are higher risk of cardiovascular disease. So that's why you may ask if kung Filipino, then definitely Filipino are high risk of cardiovascular. Kaya nga dito sa Philippines, the highest morbidity po natin ay cardiovascular disease. Okay? So next po, yan. Let us now proceed to predisposing factors. If we say predisposing, you are predisposed. Ayan. So anong pinagkaiba niya? Sa you are predisposed, you have the possibility. It encompasses yung tendencies. Yan. You may have the tendency. Okay. So this may focus on your knowledge when it comes to the normal physiologic functions or process. Just like for newborn. Okay. 'Di ba for newborn, one of the considerations natin ay why newborns are placed in a drop light. Can anyone answer? In the extrauterine light, why newborns are placed in a drop light? What's the purpose? It's different from Billy light, ha? Anyone who can answer? Why newborns after once delivered in the extrauterine light are placed in a drop light?
Avoid yellowing po.
Okay. Yung pag-avoid naman ng pag-yellow, yung yellow discoloration which is brought about by the bilirubin, sa ano naman yon? Sa Billy light. Okay, sa Billy light naman yung purpose nun. Pero yung pag-place natin sa light could be light because it produce yung heat, di ba? Nagpo-produce yun ng heat. But you have definitely a correct answer when it comes to that perspective. Pero yung drop light is different from the Billy light. Kasi yung Billy light, if you notice that the person or if the newborn are jaundice, then they will be placed to a specialized lighting so that to facilitate bilirubin regulation. But for the purpose, the Billy light is that of there are yung usually ang temperature, di ba? Ang temperature yung adjustment ng temperature from the, can you imagine the fetus is suspended sa amniotic fluid tapos it goes out of the extrauterine light of a change in temperature. So yung temperature will adjust pa. Okay, will adjust. So that adjustment goes with the body system once the newborn will be out in the extrauterine life. So the ones that we consider po in putting the drop light is for the regulation of temperature. However, in the succeeding days, it may not be essential anymore if the newborn already adjusted yung regulation and temperature. Yeah, that's it. Thank you so much, Ms. Freya. Yung poikilothermic. So these are situations wherein we need to regulate yung temperature po. So ngayon po, when it comes to the age, this is now why individuals or newborn could be high risk of hypothermia. Why newborns are high risk of yung sinabi natin kanina na hyperbilirubinemia. Why newborns are high risk for problem with temperature regulation. Why newborns are high risk for possible infection. Yan. And these are the reasons. These are the reasons for you to be guided. Ang newborn po kasi ay immature pa ang immune system. So it's not yet fully developed. Although we have the newborn may have the antibodies, may have the immunoglobulins, pero it's not sufficient. Kaya that's why di ba nga usually ang what vaccine are being given to newborns once they are delivered po. Ano po yung given po sa ano po yung binibigay na immunization?
Vitamin K.
The vitamin K may not be a vaccine. However, the vitamin K is given because to prevent bleeding. Yan, to prevent bleeding. Kasi nga, ito yung sagot diyan. Ito yung sagot diyan kung bakit nagbibigay ng vitamin K. Kasi ang liver enzymes ay necessary for detoxification of some substance na lacking pa sa liver. So, chances kasi na pwedeng mag-lead yan sa bleeding kung hindi magbibigay ng vitamin K. So that's for purpose po, connect natin sa liver kasi class vitamin K is being synthesized by the what? It's being synthesized by the liver. But the enzymes are not yet fully matured. Kaya chances hindi pa siya magpa-facilitate to have or regulate yung mga clotting factors. Okay? So what vaccine or what immunization are subject for
Hepatitis B po.
Hepatitis B could be optional, although it can be given to newborn. Ano yung vaccine na binibigay para ma-prevent yung tuberculosis?
BCG po din.
Yon, exactly. Exactly. The BCG is the one na highest priority that are being given kasi nga number one masasagot yan is because immature pa ang immune system at mas prone ang newborn sa mga ganitong problems or health condition. Kaya they need to have the immunization to produce the natural antibodies for prevention to infection. So another is ang newborns po ay high risk for nutritional deficiencies simply because they have fewer nutritional reserves. That's why we encourage, di ba, on the first 2 years of newborn and few hours pa rin yung colostrum, this will consider po specifically yung nutritional allowance or nutritional requirement that the baby may have or the newborn may have. So yun kasi yung problem because fewer yung nutritional reserves nila. Tapos when it comes to the body temperature, kasi 'di ba usually when you encounter newborns that had been delivered, 'di ba meron sila mga cheese-like na coating? Ano tawag doon?
Vernix po ba?
Yan, correct. Vernix caseosa. Ano pa yung isa? Yung hair.
Lanugo.
Yon, lanugo. Okay. What's the purpose in the intrauterine, why may lanugo, and second, why may vernix caseosa? Kasi that's that's yung protection ng baby na nakahang siya sa nakasuspend siya sa amniotic fluid. Can you imagine that? So that adds to the regulation of temperature. Kaya that's why when the baby had been delivered, 'di ba nire-remove na yung nire-remove na natin yung vernix at sumasama na rin yung ibang lanugo. It's because for the purpose naman po na iba na ang adjustment sa extrauterine life kasi normal normal environment na siya. So we need to remove it so that the body can adjust na to the normal environment normal temperature ng environment. Pero considering yung number 4 na we really need to regulate pa rin and put the baby or newborn, it's because yung vernix highly fat highly di ba yung fat niyan. Yung fat itself kasi is nagpapa-regulate ng temperature. Since it was already removed to the body of the newborn and less body fat pa rin, mas less po yung insulation niya against cold. Kaya usually they are being wrapped sa una because of the chances pa na the newborn is basically having the regulation or adjustment as well pa until the next 24 hours po that the baby already adjusted. So less body fat, yun yung reason, less body fat to insulate against cold. So with this so kung ano yung mga predisposing factors? Pag sinabi natin newborn, predisposed sila sa infection. What's the prevention? Immunization. 2, liver enzymes necessary for detoxification of substances are lacking. So that's why vitamin K are being given. Third, fewer nutritional reserves. That's why we advise the client to have high risk sila for nutritional deficiency. So that's why we take into consideration the campaign for breastfeeding. Fourth, less body fat to insulate against. Kaya nga 'di ba another din po is 'di ba much better po na the newborn will be exposed to sunlight kasi sunlight is the source of the vitamin D. At ang vitamin D po ay very important para sa regulation ng bilirubin. So, yun yung purpose. So hindi pa kasi hindi pa kasi fully matured ang liver when it comes to the enzymes that will regulate yung bilirubin. Ngayon, other than that, yung temperature is being checked din as well. It's because nga kaya nga nire-regulate natin yung temperature when taking the baby, yung taking care of yung hygiene ng baby, lalo na sa batting. It's because nga less yung body fat nila, mas prone sila, high risk sila for colds and hypothermia. So those 1, 2, 3, 4 malalaman natin na predisposed sila sa infection, predisposed sila sa problem with bilirubin level, predisposed sila sa nutritional deficiency, predisposed po sila sa cold and problem with temperature regulation, because the answer is this 1, 2, 3, and 4. Next po, other than with the newborn, let us proceed with the elderly naman. Okay. Sa elderly naman, predisposed ang elderly natin sa infection kasi decrease in immune function. Yan na yung sagot. Yan yung mini-mention ko sa inyo before when we start studying pathophysiology. Most of you will answer decrease in immune function. But let us take into consideration a deeper explanation of why decrease in immune function. It's because, sabi nga po natin, for the elders, most of them, andropause, menopause, hormone regulation. So for hormones, this is attributable to the metabolic function of the cells, and the cells are the ones that compensate the response of the body, including the immune function. So kung delay ang response ng cells, delay din ang response ng body towards immune function, and at the same time, strong defense against infection. So that's the one of the answers. So another, ang elders po natin ay decline in homeostatic mechanisms because nga, aside from the hormonal, high risk din sila for nutritional deficiencies kasi nga on the perspective po na yung kanilang mga cells cannot anymore reserve nutrients. Kaya if you will notice, sir, bakit sa integumentary nagko-cause ng dryness pagdating sa elders? It's because nga most of the cells and tissues cannot anymore reserve yung needed nutrients. So doon sila lead into that perspective, kaya nagko-cause ng change in the skin integrity. Most of the elders then are predisposed to depression, isolation, and malnutrition. Kasi ito naman, most of them are for depression kasi nga physiologic functions and processes din, neurotransmitters. So let us concentrate on how the elders will definitely respond on the perspective na why they are prone to depression. Ang neurotransmitters po diyan na eventually na being considered ay yung serotonin at saka yung dopamine. So since ang cells are delayed ang response, hindi na po niya nare-regulate yung serotonin. So that's why if you will notice, please do understand. May mga elders po tayo na irritable, may mga elders po tayo na very short ang patience. May mga elders po tayo na may mga behavioral concerns. Tayo po as nurses, we must do understand that it's not their intention, it may not be their normal behavior kasi nga the cells have the delay response when it comes to the regulation of neurotransmitters. Kaya somehow if we may not understand their reactions, their responses, their behaviors, it's part of the physiologic response brought about by their age. So predisposed sila. Predisposed din sila sa isolation kasi nga with their experiences, they feel na at their age they are not anymore parang existing sa family. Wala na siyang should I say fulfillment at her age na nakakatulong sa family because of the certain limitations. So sometimes nag-isolate siya eh. Yun yung self-isolation, it will just pero somehow mas prone naman sila sa depression on the extent na they think too much and yung kanilang mga coping mechanisms. So that's why it may depend pa rin dun sa family environment on how the support system provide appropriate care for the elders. Another is predisposed sila sa malnutrition kasi eventually even though they eat, kasi iba ang recommended daily allowance for children, adult, and elders. Kaya sabi ko nga po sa inyo, for the elders, they are high risk for problem with osteoporosis kasi nga the bones of the elders cannot anymore store calcium. Kaya most of the bones po ng mga elders ay fragile na sila. So yung formation and physical stature nila ay affected. So in this situation, alam po natin na predisposed sila because of these reasons. Kaya ito yung mga predisposing factors that we may consider po na when you have the pathophysiology framework. Next po, how about for sex or gender? Yan. We use some diseases are more prone or vulnerable to one gender than the other. Just like a typical example ha. Ito po, kaya pag you need to be voracious when it comes to evidence-based data pag gumagawa kayo ng pathophysiology. So as mentioned from the literature and from the scientific basis naman, men are more likely to develop gout. Ano ba yung gout? Anyone? Do you know what is gout? Anyone who knows gout?
Mataas yung uric.
Okay, mataas yung uric acid. So actually we have different yung uric, if mataas ang uric acid, so yun yung tinatawag nating ang effect ng increase in the uric sa blood ay once it shift to from the intravascular kasi hyperuricemia kung mataas yung uric acid. So what happens po is that whenever a patient may have increased uric acid, pag lumabas yan from intravascular to interstitial, nagiging crystal siya. Pag nagiging crystal, yung crystal na yon nagkokos ng deposits sa joints. At pag nagkokos po ng deposit sa joints, it may consider po yung possibility na yun po ay mag-cause ng friction sa tissues. Second, ay doon na po mag-start yung inflammation. Kaya nagkakaroon na ng inflammation of the joints. So men are more likely, kaya please, ayan. So you must be for preventive measures, you need to manage yung mga low purine diet na mga male students. Even though at your age, sabi ko nga, your metabolic activities are still active, pero is sooner or later, tandaan nyo ha, in the increasing age, lalo na if you reach 26 years old, ayan, napapansin niyo na pag 26 years old, nag-i-increase na yung abdominal size ninyo, madali na kayong mapagod, ayan. That is usually the age na medyo bumabagal na ang metabolic response ng body. So we must not be relaxed on this situation. So kung men are more likely to develop gout, then nutritional management could be the prevention. Another, among men aged 65 years old, so 39% on the population po ay basically on the heart diseases compared to 27% of women in the same age group. These are based from evidence-based findings. Kaya you need to take into consideration na okay pala, by age of 65 pala, high risk na sila. Kaya pag sinama nyo po yan sa predisposing factors, class pwede nyo i-separate yun ha. Kunya, for example, ang age niya, modifiable at the same time predisposing factor siya. So pwede nyo i-consider yon. So based from the evidence based po, ang 65 years old, ang tanong, ano yung dapat nating malaman or to what extent po yung information that we must know why 65 years old are more prone to heart diseases. Kasi nga, we have mentioned a while ago that the lifestyle matters or can associate with the age. Kasi nga at increasing age, kung na-engage yung individual earlier in smoking, alcohol drinking, and other factors that considers, that's why it revealed yung ganitong percentages. Next po. Any other po? Ayan. For men po, males are more prone po sa Parkinson's disease. Do you know what Parkinson's disease is? Anyone? Parkinson's disease. Usually ang Parkinson's disease ay affected dito. May mga...
Ito ba yung uncontrollable po na sa kamay, sir? Parang nanginginig?
Yeah, actually ano to it's a chronic progressive movement disorder. Usually ito yung individuals who may experience yung tinatawag nating tremors. Tremors po ang ano. Usually ang Parkinson's po nagkakaroon po ng tremors or uncontrolled shaking. Yan, mga trembling or shaking of the limb, not just only the hands. Tremors usually arms, legs, feet are usual characteristics ng symptoms po ng Parkinson's disease. This includes yung rigidity and stiffness. Yung talagang stiffness and rigidity of the limbs, slow movement. So this is usually the effect po pagka nagkakaroon na ng medyo problem ito sa nervous system, specifically sa brain. So yung ano po, yung part of the brain na tinatawag nating substantia nigra. Yon. Yung substantia nigra ng brain is the one responsible for the balance and movement, yung substantia nigra. So pag ito po ay somehow yung substantia nigra po ay na damage or nagkaroon ng injury, ayan na yung mga involuntary movements, stiffness and rigidity, tremors. So somehow ang Parkinson's disease po ay more prone po 50% of men more than women. Ayan ha. So that's why ang tanong, sir, kung predisposing factors po ito more on the men, dapat alamin nyo rin po kung ito po ba ay namamana. Class, pwede pong mamana ang Parkinson's disease. So that's why you need also to take into consideration other than predisposing factors kung ito po ay magiging, di ba pag history, anong tawag natin? Modifiable risk factors. Okay, next po. Men are also more risk of the following. They are more risk of autism. Ano naman po ang tinatawag nating autism? Any other term or medical term for autism? Any other term that we could mention to the autism? Actually, ang autism kasi ano yan it's a problem with neurodevelopment. So pag sinabi nating neurodevelopment, may mga wide range sila, di ba? You can see in the features ng may autism, problem with communication, tapos yung usual repetitive behavior. So usually po ang concern nila social, emotional, and at the same time yung communication skills ang affected. So most prone po sa autism ay male. Kidney stones, most prone po ang male. Pancreatitis or inflammation of the pancreas po, more prone po ang male. Okay. How about women? For women naman po, predisposing. Yan, sinasabi natin, predisposing po. Kaya pagka 80% po of the estimated 10 million Americans pa ito ha. Pero seemingly almost the same findings ang kino-consider natin for the Filipinos kasi even for Filipino population po, mataas po ang percentage na mas prone sa osteoporosis ang female. Okay? Now, in terms of the 80% of the estimated 10 million Americans, osteoporosis. So sabi natin, di ba, pag osteoporosis, yung problem with the storage of the calcium, so fragility of the, what do you call this? Fragility of the bone. Iba ito sa osteomalacia ha. Ang osteomalacia naman, ang problem with osteomalacia is vitamin D deficiency, nagsosoften yung nagsosoften yung bone na pwede silang maging high risk naman for fracture or pwede ring mag-lead yan sa ganyang situation, osteoporosis din. Pero moreover, ang osteomalacia, it's because of the vitamin D deficiency. So another is, ang women daw po ay higher percentage. Ito naman sa US, has a higher percentage of stroke. Yung stroke po ay tinatawag natin cerebrovascular accident. Okay. Okay. So may question po, sir, magkaiba po ba ang predisposing factors sa modifiable and non-modifiable factors po? Actually po, di ba, non-modifiable and we have the modifiable risk factors. Pwede po siya ma-utilize interchangeably kasi simply because we base from the evidences or scientific explanation. Ngayon, when it comes to most of the predisposing factors, ang predisposing factors, most yan ay naiko-consider po natin may vary depending on the latest results of researches or findings. Ang nagiging most natin na kino-consider po na predisposing factors as ay mas na-associate sa non-modifiable risk factors. Okay? So ang predisposing factors as ay most na-associate sa non-modifiable. That's why if you will notice, we have the age and the gender as part of the predisposing factors. So at least we could have the idea of how we could explain na non-modifiable siya tapos at the same time predisposing factor siya because we are always depending on scientific explanation. Kaya yung mga mini-mention ko kanina, di ba, sa newborn. Sa newborn, sabi natin, the newborn could have the modifiable kasi newborn siya eh. Modifiable risk factor siya na prone siya to infection. O newborn yun, hindi mo na mawawala kasi yun yung less fat niya. So, kung for example, magiging non-modifiable siya, it's because of yung less fat content na pwede siyang mag-lead sa hypothermia. Pag may findings na ngayon, ayan na, pag may findings na ngayon sa temperature, mababa yung temperature, nag-cause ng chills yung newborn, ayan, di ba, deviation na yun sa vital signs, mag-a-appear din po siya sa modifiable risk factors. So eventually, ang nagiging consider natin sa non-modifiable are eventually nagiging consideration din natin for the predisposing. Okay. Now, when it comes to this perspective, for a while, next po is we have the for women. Okay, for women po, women are also more at high risk for migraine. They are more high risk for migraine because why kaya high risk? Kasi as based from the as based from the research and scientific basis, hormonal related eh. Hormonal related. For urinary tract issues, why prone po ang female? So anatomical, di ba? So by anatomical po, mas prone ang female simply because of the shorter urethral canal compared to female. So moreover, mas nagli-lead into the travel of the microorganisms compared to male. Next po, multiple sclerosis. Ang multiple sclerosis naman po this is related to the problem with the blood vessels. At usually, ang affected po dito ay yung nervous system, specifically yung immune system. At ang affected po dito is nagkakaroon ng inflammation yung nerve fibers. Pag nagkakaroon ng inflammation yung nerve fibers, very common po ito sa mga ages 18 to 55 years old. Common po ito more on females, ang multiple sclerosis. So ang brain po kasi, syempre for example, nerve, may inflammation ng nerve. So kung may inflammation ng nerve, yung nerve fibers ang affected, delayed din yung impulse transmission. So they are more prone po sa female. How about Alzheimer's? Anyone who knows Alzheimer's po? Alzheimer's disease? Ang Alzheimer's naman po, mas prone po ang women or female simply because on the perspective po na ang Alzheimer's po kasi ay describe nito ay nagkakaroon ng progressive condition. Pag sinabi natin progressive condition, unti-unti pong nagkakaroon ng problem sa behavior, sa thinking at saka sa memory. So mas prone po ang women sa Alzheimer's disease. Okay? For the genetic makeup po, if we say genetic makeup, these are yung familial tendencies. If we say familial tendencies, these are taking into consideration po on the perspective that individuals have history So that's why you need to have the list. Later on, sooner or later, we'll have a topic on some of the yung mga genetic disorders or disorders that could be inherited, para at least in your by knowledge ninyo, as awareness, this could be included in your checklist. Stress also could be predisposing factors. O bakit siya naging predisposing? Although the genetic makeup, di ba sabi natin associated with non-modifiable. Eh ang stress, so di ba ang stress na mention natin ito nasa I think lifestyle. But basically pwede itong ma-predispose kasi kinonsider siya as predisposing factors kasi nagkakaroon siya ng major effect sa body. Major effect. Pag stress ka, maraming organs or systems ang affected. So usually ang stress is brought about by the increased production of corticosteroids o yung tinatawag nating cortisol. Pag tumataas yung cortisol whenever you are stressed, ang immune system naman bumababa. Kaya that's why you are more prone to infection or predisposed to infection once you are on your increased or high level of stress. Next, eto po, I just want to have a simple explanation on that. Kasi kung for example, eto yung neurohormonal response ng stress eh. At the time na you are on the high level of stress, usually po ang brain po natin, specifically the hypothalamus, we have the situation po na ang hormones are also having the response during the time of stress. Kasi usually, 'di ba pag stress, under stress ka, sympathetic response. So kung sympathetic response, labas 'yan si adrenaline, si epinephrine at saka si norepinephrine. Yung epinephrine and norepinephrine catecholamines 'yan. Pag nadinig niyo yung catecholamines, these are epinephrine and norepinephrine at ito po ay nire-release ng adrenal medulla. Okay. Now, si adrenal medulla ang nagre-release ng epinephrine at norepinephrine. So ito yung fight or flight. Sa adrenal cortex naman, ang nire-release niya yung cortisol. Okay. Yung cortisol po, ito po yung somehow na nagli-lead into the perspective na pag tumataas ang cortisol, nagko-cause siya ng problem naman ng effect sa immune system. So it lowers the immune response. So yan po yung nagiging problem. So ano nangyayari? Kung tumataas si sympathetic response, tumataas si epinephrine at norepinephrine, si cortisol naman po ay tumataas din. Ang problem naman po nito sa pag tumataas po ang cortisol, nagko-cause naman po siya ng pag-constrict ng blood vessels. So pag nag-constrict yung blood vessels, so eventually what will happen? A problem with the circulation. So another is predisposing factors din po. Yan, lifestyle can be considered po. Personal habits, diet, exercise, weight control, smoking, alcohol, consumption, and even sexual practice. Sexual practice could be also prone kung ikaw ay high risk for sexually transmitted diseases. Sexual practices also that may also prone to risk for the reproductive health of the partner. So yun po yung mga pwede natin may consider as predisposing. Usually on the personal habits. On the occupation din po, occupation could be environmental din, working conditions, yung noises, pollutants, heavy equipment and high places kasi usually pagka routinary din siya tapos present pa yung mga pollutions na ito from noise to air, pollution, environmental pollutants, this may also risk the person or predispose the patient into or client that may affect his wellness. So now, before I continue, since it's already 7 o'clock na pala, so we may have first or primarily 15 minutes break and we'll be back at 7:50 to continue our discussion. Thank you very much. Hydrate yourselves, stretch your extremities as well. Thank you. Okay, let us continue. Still with the predisposing factors, we are now on the number 7, pre-existing illnesses. Let us just connect this with the discussion, or rather with the situation that we have in the COVID-19. Um, the terms such as comorbidity and pre-existing illness are the same. So these are situations wherein primarily the person has already chronic illnesses and eventually controlled through maintenance drugs, uh, controlled by continuous therapy and treatment. So yan po yung mga pre-existing illnesses. Usually these are the pre-existing illnesses are the situations that lowers the body resistance and immune system that makes a person vulnerable to diseases. As what I have mentioned, these are the situations of chronic illnesses. So, sir, ibig sabihin mo, ang pre-existing illnesses ay saan namin may consider? So, predisposing factors na siya, tapos may consider mo na siya sa non-modifiable risk factors. A while ago, we can associate yung predisposing factors tapos modifiable, pero may mga factors na predisposing identified also in the modifiable risk factors. Kanina we have identified the lifestyle, occupation. These are controllable situations na wherein that could be associated na yan sa modifiable. So sa pre-existing illnesses is different from familial history. So pag familial history, it's obviously it's not existing pa. So that's why kung familial history, pwede tayo doon sa perspective yan ng non-modifiable. Pero pag mga pre-existing illnesses, these are predisposing factors that are identified in the modifiable risk factors. Next, when it comes to the environmental exposure, for the environmental exposure, sunlight, too much cold and too much heat can basically consider problems with body's resistance. Kasi pag prolonged exposure to cold, usually this may have the physiologic effect on the constriction of blood vessels. So pag constriction of the blood vessels, ang metabolic response natin very slow. On the other hand, pag prolonged exposure naman sa heat, ang effect naman yan sa blood vessels ay too much dilation. So kung too much dilation siya, ang chances po ay a person could be high risk naman for increased metabolic response at mag-lead naman into dehydration or electrolyte imbalance. Another environmental exposure are those usually who may have history of hypersensitivity reactions or allergic reactions, specifically on exposure to allergens. Yan, conscious or unconscious. Kasi if you say conscious, you are aware that could be controllable. But for some situations that you are sleeping or unconscious, these are some instances na uncontrollable. But still, we have our antibodies. Pero iba pa rin if you are conscious so that it could be more preventive and may not aggravate the situation. So another environmental exposure that we may consider as predisposing is long-term exposure to sunlight, which is obviously too much exposure to sunlight due to the ultraviolet rays, and long-term exposure to occupational chemicals. So these are considered as hazards. So next, other than the environmental exposure, we have, yan. So dito naman tayo on etiologic factors naman for mental deviations. I know na sooner or later, you will reach your third year level wherein you will have your professional course on psychiatric nursing. But however, when it comes to the etiologic factors for mental deviation, it is divided yung causes niya sa biological, psychological, and social, that's social factors, not factors. So, pag biological factors po, usually from the term biological, it's related po ito Related po ito sa the body's body processes natin. Pag psychological factors po, usually these are more on the self and relationship with others. Pag social factors naman po, these are factors that are eventually affected by cultural and environmental. So, just like for biological factors, usually there are some mental deviations that can be genetically inherited. So there are some yun nga, as what I have mentioned, so genetic cause, it can pass through generations. Another, pag biochemical alterations naman, usually ang concern naman dito yung regulation ng mga neurotransmitters, which I have mentioned. Pag mababa ang serotonin, mataas ang dopamine, so imbalance. So supposedly kung mataas si dopamine, tataas din si serotonin to the level na yun yung kanyang coping mechanism could have an equilibrium response. Pero there are some situations na stress can trigger lowering down of serotonin eh. So yun, most probably the person cannot focus, the person could be deprived from the supposed distress level na he doesn't deserve, pero hindi niya na sometimes nakokontrol. These are biochemical alterations. Infections naman, if directly, since the brain is the one that is responsible for alertness and many functions related to thinking and responses. So if it caused the infection at the same time with the intoxications, this may possibly consider po of the alterations with the control of neurotransmitters. So we can consider na rin yung brain damage or injury, direct trauma or indirect trauma, yung tinatawag nating yun nga, it's trauma or injury na basically affects yung physiologic processes and functions po ng brain. Another is pwede rin siyang vascular causes. Yung vascular causes, if we are talking about blood vessels, that directly consider po sa brain function din yan. Kasi kung a person may have the problem with vascular disease or anything that affects the blood vessel, so it affects also the cerebral perfusion or circulation. So ma-alter din yung pag-regulate of the neurotransmitters. Yung perinatal causes naman, perinatal causes, usually ito po ay naiko-consider po natin sa congenital. So pwedeng by history of the maternal or maternal history, this was brought about by the development of nerves na naka-affect sa development, sa nervous system development ng individual. On the psychological factors, so we have considered po maternal separation, ayan, abnormal parent-child relationship. So actually from marriage problems, stress, season, sexual difficulties, low self-esteem. Usually pag psychological, if we go on with the Maslow's hierarchy of needs, yung psychological factors pumapasok yan sa pumapasok na yan sa next level na yung 'di ba yung love and belongingness, self-esteem, self-actualization. So yun usually ang kino-consider na psychological factors whenever it is not met. And usually these are the situations na the person could be deprived from the coping mechanisms. Now when it comes to the social factors, poverty. So bakit poverty? Sinisinan naman natin sa kahirapan. Pero let's face it, pagka ito ay nag-connect, ayan, connect na natin sa unemployment, yung prioritization is a concern. Sometimes hindi napaprioritize ang medical consultation. Other than that, yung nutritional management na hindi na-meet yung mga recommended daily allowance that is needed by the body. So may effect yan, may implications yan with the cerebral function that is directly associated with mental health. Urbanization probably kasi because of the situations, just like itong mga protocols that may inhibit individuals to have interaction with each other. Alcoholism, yung alcoholism bakit siya consider as social factors kasi it could influence, 'di ba? It could influence kung yun ang environment, it could still continue yung influence for you to be engaged into the vices. broken homes, so social factors siya kasi this may consider po yung effect when it comes to communication. Religion and traditions, bakit siya kinonsider? Kasi there are some situations na yung certain religion and traditions set limitations na nag-lead into social deprivation, limitations na very much important when it comes to mental health. Now, when we talk about the predisposing factors, we have mentioned yung term na prone, di ba? Prone siya. So sa mental deviations po, usually po ang mga kino-consider po natin na contributing, yan, the term contributed, predisposing, yan yung term, contributed to the person's problem is predisposed po pag mental sa age, genetic factors po, so if it is inherited, intrauterine po, prenatal o perinatal situations by history, maternal history. Chronic diseases, predisposing din ito kasi because of the situation that deprives the mental process or function. Early life adversity. Pag sinabi natin early life adversity is the person had been exposed to the environment. Kasi kanina 'di ba we have mentioned yung mga yung mga predisposing factors and one of which is yung environment. So there are some situations na 'di ba sa growth and development we have considered po yung appropriate play, appropriate environment, appropriate needs for every stage. Pero naging predisposed ang individual pagka yung mga early life adversities, pag sinabi nating adversities, these are situations na there are certain stages in life or development ng person na hindi na-meet yung needs. So these are predisposing. So the term is contributed. Pag sinabi naman natin precipitating, what triggers the onset or the start? Ayan what triggers the onset of behavioral response? So predisposing, contributed, pag precipitating, what triggers? So sa mental deviation, usually physical yan. As what I have mentioned, trauma, infection, intoxication. So usually we have mentioned dito sa biological, di ba? Then psychological, conflicts, frustration, bereavement. Aware naman tayo sa DABDA. If you are aware of DABDA, ito yung usual na pagdadaanan ninyo whenever you experience yung sa grief or some situations na denial, anger, bargaining, depression until acceptance. Pero it doesn't mean that you will pass all through these stages. There could be instances na kung strong ang iyong ang support system and strong ang iyong self confidence to cope. There are some instances na you are on denial pero ang bilis ng pacing mo towards the acceptance. So it doesn't mean naman dadaan ka pa ng anger, dadaan ka pa ng bargaining, pero that's the usual pacing. Pwedeng very short, pwedeng hindi mo na experience, pero pwede mong merong na over parang na-override mo na yung stage na yon. So it may depend on the person, pero yung iba kasi humihinto sila doon sa sa hindi siya nagre-reach sa acceptance kasi nandun yung anger. So hindi siya mag-reach into to the acceptance kasi nasa denial ka, nasa anger ka. Doon sa bargaining, it's weighing things for you to cope, pero hindi ka nagpo-proceed doon kasi you still have anger. So next po, epidemic health concern. So epidemic is different from pandemic. So pandemic is worldwide, ang epidemic ay national or localized lang siya. So nagti-trigger ito because of anxiety din, yung epidemic health concerns. Because of fear. Pag sleep deprivation, alam natin that sleep is very important, part of the physiologic needs. Pag na-deprive, this may trigger po yung brain functioning din. Physical restraints and sepsis, so these are yung limitations and the infection itself, pwedeng mag-trigger po yan into the mental deviations. Next po is perpetuating. Yung perpetuating factors naman, ito naman yung mga factors of negative symptoms about illness or condition. Pwede kasing different ito from precipitating at saka from predisposing. Predisposing kasi, nagli-lead ka into a decision sa health mo na pwede mo siyang i-control. Ito naman perpetuating, pwede mo siyang i-control pero sometimes yung practices mo is the one leading you to aggravation of your condition. Kaya perpetuating factors, example, harmful illness beliefs. So sa mga far areas po natin, sa mga far-flung areas po natin, may mga beliefs pa rin na they do not they do not embrace yung scientific explanations and medical treatment. So albularyo, mga painkillers. So nandun pa rin. So that's why sometimes it aggravates yung condition na hindi ka naniniwala on the scientific basis ng actions. Negative health habits. Ano yung mga negative health habits mo? Perpetuating factors 'yan. Things na practices pero sometimes most of the time aware ka na that it may lead to complication or risk mo to a certain illness, pero ano pa rin ginagawa mo pa rin. One of the example, alam mo naman of the use of the PPE. So sa PPE, face mask is one of the, other than it's not number one, it's secondary. Ang first talaga is the hand hygiene. So yung negative health habits mo, anyway, hindi ka nasanay when it comes to the hand washing. You are having the face mask. Pero syempre pa rin universal precaution siya eh. So anong pwedeng maging maging concern mo doon? You could be high risk. You could be high risk if you're not practicing it. Misinformation. So these are the things that may possibly maging dependent ka on information that are only available in the social media, but you are not consulting medical experts. Perpetuating factors din yung social support factors. Pag sabi natin social support factors, mas naniniwala ka sa marites. mas naniniwala ka sa mga health habits na nakapagpagaling ang certain things na wala namang evidence-based explanation. Another perpetuating factors yung chronic illness kasi sometimes they consider yung experiential. Ito yung experiential. Remember class ang mga po natin, remember multivitamins, all supplements, no approved therapeutic claims 'yan. Kaya nga sinasabi ng FDA na no approved therapeutic claims because it's not used for treatment of illnesses or diseases. Pero there are some instances na kaya if you will notice sa mga promotion ng mga supplemental drugs, they are more on the sasabihin gumaling yung diabetes ko, gumaling yung hypertension ko. It's only experiential but no scientific basis na nag-direct siya dun sa treatment. So pwedeng na-control but it is embedded pa din yung practices mo, yung positive practices mo on nutrition, exercise, stress relieving measures aside from the supplement. So pero once you have been exposed to testimonies na gumaling diabetes ko dahil sa gamot na ito, sa testimony. So pwede kasing mag-cause yun na maging dependent ka on that situation because of the experiences. Pero no approved therapeutic claims pa rin eh. So let's set that perspective na hindi pa rin siya used for treatment. Okay, so I think that ends up my slide. Any questions so far? Okay, so if none, I'll stop my recording already.